So you want to learn about the vaginal pessary. If you've never heard of it, you are not alone. Most people have no idea what this is, nor would we expect them to. A vaginal pessary fits inside the vagina to lift it up. Think of it as a crutch or splint to support a weak pelvic floor and organs that have shifted out of position. If your pelvic floor is weak, or your pelvic organs are not well supported, you could get a bulge in the vagina, called prolapse, or a leaky bladder, called urinary incontinence. Pessaries can be used to treat both. Pessaries have been around forever. In ancient times, pomegranates were used as pessaries. Modern pessaries are made of silicone or medical rubber, and they fit like tampons in the vagina to give it extra support. Unlike tampons, though, they don't absorb vaginal secretions and don't increase your risk of infection. Also, you don't need to throw pessaries out, but instead, you can wash them with warm soap and water and reuse them when you need. If you're curious about whether or not a pessary will help urinary incontinence, you can try one out without seeing a healthcare provider. You can purchase one online or buy it from a pharmacy. This type of pessary is called Uresta. A doctor, nurse, or pelvic health physiotherapist can recommend other shapes and sizes so your pessary fits just right for prolapse, incontinence, or both. You may need to try a few different pessaries before you find one that feels good and works well. 3 out of 4 women who try a pessary can be fitted successfully. You know you have the right pessary when it's comfortable, you feel supported, and it doesn't fall out when you're active. Just like a tampon, you shouldn't feel it inside. You may have to return for a second or third fitting to discover the best pessary for you. Once you find a pessary that works, you can also learn to remove it and replace it yourself at home. You can keep your pessary inside the vagina for up to 3 months. The pessary can stay in while you're having your period. You can also take the pessary in and out every day or every few days. If your pelvic floor problem only bothers you during certain activities, like exercise, you can put your pessary in for that activity and remove it later. Many women use a pessary only when running or biking. To remove a pessary, you can reach into the vagina to grasp the pessary edge, break the suction, and pull out gently. You can also ask your partner to help you. Tying a piece of dental floss to the pessary makes it easier to remove. Just make sure you pick floss with no scent or flavor. If you don't want to remove your pessary yourself, you can see a healthcare provider every 3 months to have it removed, cleaned, and reinserted. Pessaries do not need to be removed for sexual activity, but you can choose to remove it for your own or your partner's comfort. If you're using a pessary, you should see a doctor every year or 2 to review how you're feeling and have an examination. Your pessary size and shape may be changed at that time. If a pessary works for you, it can provide immediate relief and treatment and can help to avoid surgery. Pessaries do not affect fertility and can be used during or between pregnancies. Although pessaries are very safe, they do have some risks. If you forget your pessary inside for over 3 months, it can irritate the wall of the vagina. This can be treated by taking a short break from the pessary. To improve your vaginal health while using a pessary after menopause, your doctor may recommend the use of low-dose vaginal estrogen as a moisturizer. You may also experience a vaginal infection. If you experience bleeding or discharge, this is not normal and you need to see your doctor about it. Vaginal infection is rare and may require testing and treatment. There are no long-term risks to your health from using a pessary, and so it can be used for life. Some women say their pessaries are life-changing. Some women wear pessaries for a short time, then look for other treatments. And for a few women, pessaries are not a good option. Please talk to your doctor if you would like a pessary fitting to try it out. So remember, a pessary can be used for prolapse or urinary incontinence. If it fits properly, it can help you avoid surgery and return to all of your usual activities, feeling more confident and supported. You should not leave your pessary in for longer than 3 months, and you should report vaginal bleeding or discharge to your doctor.